Medical professionals of Reddit, when did you have to tell a patient I've seen it all before to comfort them, but really you had never seen something so bad or of that nature? Probably too late to the party, but I had a lady come into the ER listed as multiple medical problems. This usually means diabetes and the issues stemming from it, or maybe bleeding issues from another disease, or maybe odd blood tests results at a clinic. I hadn't seen the patient yet, but the doctor came to the nurse's station asking who had room 15. I jumped up and followed him into the room. I walked in and saw what I thought was a corpse. Then the patient's eyes swiveled over to look at me. She truly looked like one of the people they found in a concentration camp. I could see every bone, and her body was twisted in a decorticate position, with her jaw locked open. Then the smell hit me: rotting flesh, death, and body fluids. I struggled to keep a neutral face and not gag. I tried to place a blood pressure cuff on her arm, and her skin just started flaking off in my hands. I gagged. The doctor started removing her clothes to examine her. Her feet were black to the ankles. Her hip bones were poking through her skin and were black. The skin around her ribs was worn away to oozing muscle fibers. Her calves were incredibly swollen, and the skin was splitting like ripped pants. I removed her depends, and there was feces coating her entire genital area. Then the doctor went to remove a large bandage on her lower back. Her entire sacrum was exposed, and the bones were black. The skin around it was a black liquefied mass. It smelled like nothing I've ever smelled. I can't even describe it. The doctor told her family I would clean up her ulcers and wounds in preparation for surgery. Liar, no surgeon would operate on her. I had no idea how to clean dead bone tissue and liquefied skin. They don't cover that in nursing school. When I went to clean her sacral area, all the liquefied skin separated and oozed all over the bed. I really struggled to keep my shit together. Afterwards, I needed a moment in the supply closet to cry it out for a second. I had no idea the human body could break down so much without dying. I still think about that woman sometimes and what led to her living like that. It still breaks my heart. In dental school, I had an emergency patient come in complaining of sore gums. Upon examination, I found a massive calculus bridge behind her lower front teeth. She only had about 3 remaining lower teeth, but they were all connected with a whitish-brown mineral deposit that was about the size of a golf ball. She had never had her teeth cleaned, and she was probably 55 or so. I basically performed an emergency cleaning. She could speak so much better afterwards. Of course, I had to play it off like it was normal, but in my